Okay, so talking about toxoplasmosis, and this goes under the kind of protozoal diseases that we can see. Um, and so what we're looking at when we look at toxo, sometimes people just abbreviate as toxo, it is an obligate intracellular, it's a coccidia-like protozoa. So it does resemble coccidia. There'll be some other pictures later. It can infect a majority of mammals, but cats are kind of known as the definitive host. What do you want Cat to say hi today? He's like excited I'm home. So cats are definitely, like dogs can get it, rats, mice. I mean, many mammals can be infected with toxo, but cats are known as the primary host. And it can be worldwide. There's some notes under here, more humid climates. Now, the problem with toxoplasmosis, clinical illness, kind of depends on where. So these cysts that form with toxoplasmosis tend to live in the tissues and can embed in the tissues. So obviously, if they have a higher burden, it can cause issues of inflammation within the tissues. And it depends on the degree of injury. So, a higher burden, more likely to show more clinical signs. And basically, when they ingest the cyst, so by eating, and I'm going to talk about kind of the life cycle, but if they ingest, if a cat eats a mouse and a mouse had toxoplasmosis, obviously it's going to go through the intestine, but when it gets embedded in the intestinal wall, it can spread through the bloodstream and can travel to different organs through the blood system and the lymphatic system. And this is what can cause issues with different organs. And when we talk about necrosis is when tissues die. So if there is enough of these cysts that embed in the tissues, it can damage those tissues. It can cause them to die off, which then is when we would begin to see the clinical signs. Again, it is rarely fatal, but it can cause a degree of illness. Now, there's some notes under here and understanding the difference in what we're talking about. An oocyst, similar to when we were talking about, Giardia, and they kind of embed and then they shed. What can happen here is the oocysts have the sporozoites, and anything that has spore forming, that's what is shed. So normally if we're going to look on a fecal, we are looking for the oocyst form. You can see them sporulating, so we will show a picture of that. Now the tachyzoites are rapidly multiplying. Once they get to the tissue stage, when they migrate, they would rapidly, if it's a bradyzoite, they are slowly migrating. So they can have either form, and tachy means fast and brady means slow. So it can multiply fast or slow in the tissues. Now, what happens sometimes when these tachyzoites, they move into the tissues, when the body starts to fight something, sometimes it walls it off. And when a body walls off when he walls off these organisms, they can form cysts. Now, a cyst is literally a fluid-filled structure. So what can happen if you have enough of these sporozoites that move into the tissues and they get embedded, and then the body it's like a cyst in the tissues, or a cyst in the muscle, or a cyst in the organ. And, a cyst will put pressure. And that's what we were talking about when I say like clinical signs. When they're going to show actual signs of illness, if they have enough of these cysts that have formed around these organisms, it's going to cause a problem. And it's typically what we talk about in the muscles. But again, there are muscles in organs, so they can go into the organs, or they can just go into the skeletal muscles and form these cysts, which can cause pain and discomfort and illness. Now they can actually, there's a note here, in the central nervous system, they can have the dormant form of these bradyzoids, and so they can kind of remain in the tissues. When we talk about the routes of transmission, one of the most common routes is eating contaminated meat from an intermediate host. Now, if I talk about cats as the primary host, if we talk about, now I'm not talking about if you give them a piece of chicken. I mean, although, we're talking usually about they're getting into rodents outside. Did they get a mouse? Did they get a mole? Outdoor cats tend to find critters and eat outside, and that's going to be their most common spread. There is a fecal oral route, so obviously if they ingest feces. Now, most cats, we worry about dogs going out and eating their feces, but if a cat does step in the feces and groom themselves, that's a fecal oral contamination. So maybe they're not eating the feces, but if they are in the feces of a contaminated sample, then that's going to. There is some transplacental. So again, if the mother has it, she can pass it to the young if she is positive. Now, here is some notes again under here, which is kind of what I've already gone over, is just the different oocysts to the tachyo or bradiozoite to those forms, and then the tissue cysts. Now, when the tissue cyst, the oocyst walls, basically when they ingest an oocyst, when the oocyst is ingested, the digestive juices break down that wall, and that's how it releases the bradyzoites. So basically, you think about eating or taking a medication and the capsule disintegrates and it lets out the medication. If the animal ingests the oocyst and the wall dissolves, it releases those inside. So the bradyzoites, they basically attach to the small intestine and they get absorbed into the intestinal lining, which basically goes now into the blood supply and the lymphatic supply. And this is where they first migrate to the small intestine. That's where it's going to begin. But then it's going to start to travel and they start migrating through the tissues. So in about 3 weeks, they can start to become very walled off, very resistant in the tissues. Now, here's some other notes in skeletal muscle, myocardium, which is heart muscle, brain. These are all of the different places where we can find these different cyst formations in these muscles. Now in cats, they will shed the cyst form, the unsporulated, that cyst form, and it can take about 1 to 5 days to sporulate, and they can shed up to 1 to 2 weeks. So they can be continuing to shed, and where does a cat shed? Well, where they defecate. So obviously in the litter box, or if they're outdoors, cats sometimes like to defecate along, in garden beds or around a house foundation, anywhere like a cat tends to go. At my grandparents' house, I remember when I was young, they had very soft dirt around their house, and I was helping my grandma in the garden, and oh my gosh, the amount of cat feces that was just in the garden bed around the house, because it was very soft dirt, kind of like an outdoor litter box. Oh, sandboxes. So if a cat, outdoor sandboxes are kind of just litter boxes for like raccoons, wild animals, outdoor cats. So I was always like, I didn't really have an outdoor litter box. I didn't have an outdoor sandbox for my kids. We live by woods. I was like, I'm just inviting things. But if you are going to have a sandbox outside, as a side note, you usually want to keep it covered, and usually put like something on the cover so they can't knock it off. And again, because your kids are going to go out there and play in the sand, come in, eat lunch, again, you want to be cautious. So they can be shedding. So again, eating that contaminated meat. So, that's where we're always, and I'm going to talk about pregnant women because there's a very, you have to be really cautious when you're pregnant. about toxoplasmosis, but you definitely, pregnant women, you're not really supposed to eat sushi or eat any undercooked meat. You definitely want to cook it well because, again, if there's anything, any of these cysts in that meat, that's another route of transmission. And then food or water. So again, if something defecates in the water and something drinks water outdoors, so yeah, again, that standing water and things like that. Transplacental, really sheep's, goats, people, small rodents. Inhaled aerosols. So if fecal matter gets dry enough and powdery and windy, can potentially be inhaled. That's not a very common route. And then also because they can be carried through the blood, potentially through a blood transfusion, but that would be pretty rare. It's just all, obviously eating a contaminated host and the fecal oral is the most common routes of transmission. This isn't super clear on my screen either. I can try and find that, get this picture to clear up. But basically it's like a cat is infected by eating the host, and then the host is passed in the feces. Okay, and as it's passed, the oocysts in about 3 days become sporulated, so they can be ingested through the environment. So here you've got this mouse that, eats it. We've got the reproduction in the tissues, and other animals can feast on different hosts, but then it spreads these tachyzoites, bradyzoites, and you can see how the cycle just keeps repeating itself. So, especially if they're outdoor, they're going to have a higher chance of getting this versus an indoor cat, and we'll talk about that. So the cysts typically produce a low form of the disease. A lot of times there's not a lot of clinical signs with this, but I've said this before, if you have an animal that has any immunosuppression disorder or they're on immunosuppressive drugs, and I'm talking like high dose, like usually when we give animals prednisone, which is an immunosuppressive, if we give them to them for allergies, we're not talking high dose, but like when my dog was on pred for meningitis, he was on a much higher immunosuppressive dose. So depending on the dose, you cause, you don't allow the body's own immunity to kind of fight it off, because of this. So anything if there's another infection going on, if the dog has an immunosuppressive disease, or if they're on immunosuppressive drugs, that animal has a higher chance of having more clinical disease. Now, there are reports that 30 to 40% of people and cats can actually carry this, maybe 20% of dogs, and seropositive. So seropositive means that they've done a test on the serum. Now, maybe they would be negative on a fecal, meaning they're not actively shedding it. But if there's a blood test done and it's basically searching for that antibody to it, or, that there's been a presence, then, and the problem with some of this sero testing that I will say is, sometimes it can show that you were exposed, but maybe that there's not a current infection. So sometimes these serum tests aren't always 100% conclusive. But again, if there's any positive serum test, you either had it or currently have it and can be carrying it. And remember, I've talked about some of these diseases. If I say something is subclinical, that means there's illness present, but not enough to cause clinical signs. Again, if a disease is subclinical, it means the animal is still affected. They're just not affected to the point where it's altering anything about their daily activity, routine, behavior, health status. And most of the time, people and animals are asymptomatic unless again, they have an immunosuppressive or a very, very high burden. And Toxoplasma gondii, there's a note here. I mean, we just kind of call it toxoplasmosis, but Toxoplasma gondii can survive in food animals for a very long time. So the problem is when an animal is affected by this, it's called a multi-systemic disease. And I think your chapter in your book, it talks about pan-systemic diseases, meaning more than one. So it can affect skeletal muscle and organs. And now a lot of cats can get some intraocular inflammation or uveitis. So uveitis is when they have an inflammation on the inner chamber of the eye, and it can cause pain, it can cause redness. So potentially some ocular problems in a cat. It tends to favor the lungs and the eyes. So it's usually so if there are enough cysts in the lungs, theoretically coughing, they might notice some scarring if they take a radiograph. And again, it can look like other illnesses. But in dogs, they tend to get more GI effects, neurologic effects, but it can affect all of these different organs. Now, cats, more than dogs, tend to have more signs of symptomatic disease. So again, because a cat is the definitive host, this is where we're going to see most of our issues. And depending on the site and the extent of damage is going to depend how many clinical signs. Again, if it's subclinical and the animal doesn't show much, that's different. But again, acute, sometimes when there's the initial burden right after infection, you might see it. But again, they can have reactive cysts following an immunosuppressive event. So let's say, for example, a cat has toxo and they have not had any symptoms. And then all of a sudden the cat gets an upper respiratory infection and the cat is feeling very, very ill. And then, anytime they experience a severe illness, or let's say they were put on immunosuppressive drugs and then all of a sudden this, what we call a latent infection, like it's in the body, it's not showing clinical signs, all of a sudden kind of comes out. So it lets that kind of infection take hold and become apparent. So some of the clinical signs that we will see initially is they will be lethargic, depressed. They might be anorexic, and they might actually have weight loss because it just, they have this feeling of malaise, which is like, I just don't feel good, But again, we're going to have to do those clinical signs are in about 100 illnesses. So it's not like zeroing in. They could have a fever. What you can start to notice is they have an ocular discharge and photophobia and myotic pupils, which is kind of like where they constrict. Now, if you think about uveitis, and I don't know in one of your other classes if you talked about eye diseases, but uveitis is inflammation of all those inner sensitive structures of the eye. And photophobia means you don't want to look at the light. So for example, when I've talked about meningitis, because I've had 2 dogs with meningitis, both of them were photophobic. So if they look up at the light, they're squinty, and it means looking at the light hurts. So photophobia is usually they avoid bright light, or they kind of squint or put their head down because light is putting pressure on the eyes and it hurts. And the problem is they'll probably try to constrict the pupil and try to avoid light. Now that's a clinical sign of meningitis. In fact, in people, if you have sharp neck pain, if you can't put your chin to your chest, and if you look up at the light, and kids don't want to look at the light, those are all kind of clinical signs that are seen with meningitis, because the inflammation of the meninges makes your head hurt and looking at the light hurts. So if you've never heard of photophobia before, that's what it means. It's like avoiding looking at bright light, basically. And because their eyes hurt, they don't want to look at bright light. It's part of that uveitis. And they can have some respiratory distress. Now, respiratory distress can mean a whole host of other illnesses, but again, because these cysts can form in the lung tissue, it can cause scar tissue in the lungs, which makes your lungs less able to diffuse oxygen and to breathe normally. So anytime you have any scar tissue in the lungs, that's going to potentially, depending on the degree, cause a degree of respiratory distress. And neurologic signs, digestive. Well, now neurologic signs, they might be drowsy, walking abnormally, seem painful around their neck. Digestive signs, obviously, we talk about vomiting and diarrhea. And if they were actually a pregnant cat, they might give birth to stillborn kittens. Now, if you're a cat breeder, you're probably more interested in why were these kittens stillborn. The only options you really have, and actually at the very end of ClinMed 3, we talk about necropsy. And one of the reasons we talk about it in this class is that if we're talking about ruling out infectious diseases, some of these protozoal diseases, and if you have a litter of puppies or a litter of kitties that die or that were born stillborn, you can send that deceased kitten to the lab, and they will test all of the tissues, and they will look for toxoplasmosis because it can cause these stillborn so they'll do the further testing. And like I said, that's what we end with in ClinMed 3. We actually have to practice a necropsy on a dead rat. So we will have some skills week 8, fair warning. We do have to take a rat and pretend to take tissues and how, because again, if the owner brings in these stillborn kittens, usually the clinic, it's their job to package and prepare the samples and to send it to the lab. So something that could be done, sometimes people, if they have a puppy die prematurely, sometimes they bring it in and they want us to tell it why. Well, if you guys have not heard of it, at Purdue, it's a building right next to the veterinary school in Lafayette, but it's called ADDL. It's the Animal Disease Diagnostic Laboratory. And it's actually it's the state animal disease lab. So it's attached to the vet school. It's technically not part of Purdue. I mean, a lot of Purdue people do stuff in that lab, but it's actually a lab for the whole state. And when I was a student, we all had to rotate. It was a necropsy rotation. So we had to spend a week, and they would literally just get shipments from all over the state of, unfortunately, sometimes it's a couple pigs from a litter that died, or it could be a puppy, or it could be an adult dog. One time they brought in a cow that they found dead in the pasture, and we had to, it's not dissection, it's actually called necropsy. We had to take samples because they were like, why did this cow die? So literally there is a lab in the state that if anybody, some veterinarians will do their own necropsy. They'll try to open them up and say, oh yeah, the heart looked abnormal, or it's, it didn't form properly. But if they want definitive answers, they will send it to the lab for what's called a necropsy. And again, we'll get into that more in depth, but I kind of wanted to explain options for diagnosing this. So normal diagnostics, if something comes in that's literally like not eating, anorexic, lethargic, your CBC, you could have what's called a mild anemia, but this anemia is normocytic normochromic. Now, if you remember from lab 1, normocytic means all the red cells are of normal size. Normochromic means all the red blood cells are the same color. When you get polychromasia, it means there's different colors. Does anyone remember, what does that mean? What does polychromasia indicate? So if you do a CBC and you do a blood smear and you have an animal that's anemic, if you have polychromasia, it means your red blood cells are different colors. And normally that's a good sign because immature red blood cells pick up different amount of stains than a normal size red blood cell. So polychromasia is an indicator of different ages of cells, and that tells you it's regenerative. And normocytic is they're all of normal size. Yes, so polychromasia is is usually a sign of regenerative anemia, where anisocytosis is also a sign of, I knew what you meant, but is also a sign of regenerative anemia. So in this anemia, it's mild, so we're not really looking for, though, but you would see anemia in the face of normocytic, normochromic. But some cats, if they have a severe burden, they will be leukopenic, meaning they have an overall low white blood cell count, because sometimes it will affect their ability, if they are immunosuppressed, and it affects their ability to make these white blood cells. Now, you can get increases in ALT and AST. Both of those are liver tests. So alanine transferase, ALT and AST are both liver tests. And sometimes, because it can affect the tissues of the liver, sometimes it causes an increase in these enzymes. Can have pancreatitis because, again, it can infect those tissues and cause inflammation. And sometimes we can get a protein in bilirubin. So now there's a separate note here these are some advanced tests. Bradyzoites that are rarely detected in effusions. BAL stands for bronchial alveolar lavage. You don't have to know that for the test. But a bronchial alveolar lavage, because bronchioles are in the lungs, sometimes when animals are having respiratory difficulty or coughing, you take a special catheter, you put a little bit of saline in the lungs, which makes them cough, and then you suck up some of what they cough up. There's a potential to find some of these, walled off cysts, or some of those of the sporocytes or the oocysts. You might find those. Aqueous would be, normally we don't take an aqueous sample, but that's taking some sample of the fluid behind the eye. And obviously a CSF, if we do what's called a spinal tap, where we want to take some cerebral spinal fluid, if it has migrated to the tissues of the CNS, you could potentially, but they're rarely detected here. Now, you can do serology testing. Again, sometimes that serology testing, if it's positive, we're talking about serology like ELISA testing. If it's positive, it may be that there was an infection. When you do serology testing, and sometimes we look at doing titers. Now, titers will tell you how much antibody formation is made to an antigen. And sometimes those titers are going to be a little more specific to tell you, is there active infection or was it a previous infection? So you may still need some testing. Can see some pleural abdominal effusion. If you remember, pleural effusion is fluid in the chest cavity around the lungs, and abdominal effusion is fluid in the abdomen around the organs. Remember, edema is in tissues. So you can get some of this fluid. And then hepatomegaly is an enlarged liver. So sometimes the liver gets enlarged, it gets these cysts, it gets inflamed. So sometimes on an x-ray, you'll see a bigger than normal liver. You might see fluid in these cavities. And then on the CSF, when you guys do Animal Tech 4, you talk about cytology of fluid, like what cells should be in fluid. Now, CSF fluid is supposed to be one of the most protected fluids in the body. It's supposed to be clear. It really doesn't have a cell count. So if you have leukocytes or white blood cells in spinal fluid, that's extremely rare. And again, that's an indicator. White cells go to infection. White cells go, so if the white cells are in spinal fluid, it means something has migrated or penetrated. Now, it could be bacteria, it could be fungi. I mean, just because there's a high leukocyte count in spinal fluid doesn't mean it is toxo. It means that the body is fighting some infection or inflammation in the spinal column or around the brain. This could be one of the things that they would look for. Now, on cytology, if you take samples of tissues, sometimes you can see a tachyzoite, but that would be rare. And then obviously it can be seen on a fecal exam. But when you have an animal showing multiple kind of vague clinical signs, you're probably going to do now cerebral spinal fluid test, that's a spinal tap. That's not done like every day. That's a specialized test. A serology test is a specialized test. You usually start with your CBC chem, radiographs, and then you kind of go from there. If we're going to see it on a fecal, and we're looking here, okay, we've got some white blood cells chilling out, but we've got this, we've got this different, I'm sorry, coccidia, not white blood cells. What am I talking about? This kind of reminds me of a urine sample in a way, but you can see this is one of those sporulated. You've got two in here, and probably the next slide is better. If you got this fecal float here, you've got sporulated versus unsporulated. So with the blue arrow, you can see the unsporulated. This is not stained. It has kind of a double wall. And then sporulated has a thinner wall. And you can see that it has two sporocysts. Now, when this is ingested, this wall will disintegrate. These two guys will go into the intestinal wall, start to spread, but then they will also continue to shed, and some will remain in the intestine and shed in the feces. So you can see kind of the difference on here. As far as treatment, I think I've been saying this over and over again, supportive care. And I need you to know what supportive care means. Supportive care is basically IV fluids, because if you have an animal that's anorexic and not eating and drinking, they're potentially dehydrated. Maybe they're painful because of these cysts, so maybe we're going to give them pain meds. Potentially they're going to go on anti-inflammatories. Potentially we're going to do supportive care for nutrition, because again, if they're anorexic and weight loss, we might be feeding. So those are examples of supportive care. Supportive care is not treating the illness. Supportive care is supporting the clinical signs of the animal with the illness. Now, prognosis, if the cat, if the cat is showing more severe signs, progressive uveitis, progressive respiratory distress, and are they responding to therapy? Are they responding to antibiotics? Are they responding to fluids, appetite stimulants, all kinds of things? If they're not responding, or the response is not what is expected, then it can be a guarded prognosis, meaning we don't have as favorable of an outcome. Now, this can be treated with clindamycin, which is a very standard antibiotic and has to be given with food. It tends to be kind of irritating. It's a stronger antibiotic, but usually it's given twice a day for a minimum of 2 weeks. or it has to be repeated until they are not showing clinical signs. So most of the time, like I've said before, is we will prescribe the antibiotic. We might say come back in 2 weeks, repeat. Now, whatever test diagnosed it, you might repeat a fecal. You might repeat a serology test. You might sometimes, and the owner might say, oh, my cat's fine, I don't want to come back. Well, a client always has free will to do what they want. We want to make sure that it's gone, because the thing to impress upon clients is that these cysts can be still living, these cysts can be still shedding. And even though sometimes the clinical signs improve, we don't want to leave organism behind. So, there is a justification to say come back in 2 weeks or recheck. Now, the other thing is, when we talk about supportive care, since this does tend to affect the eyes more than, say, other body systems, they may need something for uveitis, some type of eye drops that will bring down the inflammation. So you might prescribe clindamycin and eye drops, not clindamycin eye drops, but separate eye medication to help bring down that inflammation in the eye, because again, uveitis is a pretty painful condition. And that'll make them, and one thing I forgot to mention is, what are some other signs of uveitis? Are they pawing at their eyes? When they look up, are they squinting and excessively blinking? Think about, what would you do if your eyes hurt? What would you do? If I looked at the light and I'm squinting and I'm blinking and I'm constantly rubbing my eyes, and I'm, cats obviously don't go like this, but when your eyes hurt, you're kind of like, oh, so those are kind of signs. An owner might say, I think something's wrong with his eyes because he keeps pawing, he's tearing, he won't look at the lights, he's constantly blinking. These are all things that we can look for. So sometimes they'll be put on eye drops. There's notes. You can treat for a week, you can continue up to 4 weeks, and the eyes, steroid. Now, again, that's going to be dependent on the doctor, talking to the client, at what treatment path. The best way to think about this is, how do you prevent it? And number one, try to not allow cats to eat raw meat, bones, viscera. Viscera are organs. So how do well, I can tell you, I have indoor cats. I don't have unpasteurized milk, but if they live on a farm and they drink the milk, sometimes they're milking cows, and they'll give the cat some milk directly out of the cow. It's not pasteurized. It's not been treated yet. So, obviously if they're an outdoor cat, ding, 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 keep your cat indoors. If you have an indoor cat, they're not being exposed typically to mice outside, or, I'm not giving them raw meat when I'm cooking, and avoid them hunting prey. And again, if you keep them indoors, there's going to be a much lower risk for this. There are a lot of notes under here, and let me just go through this, because you have to, there is a very high zoonotic potential, and primarily it comes from women cleaning litter boxes. I actually I kind of said this to my husband, because I had cats when I was pregnant, and I was like, oh honey, you have to do the litter boxes, because I'm not supposed to touch the litter boxes, because there is a chance. My cats were indoors, but both had a stray history. So they can be subclinical. They could be passing this in their feces. And so technically women, pregnant women especially, but, can be passed through the litter box. So number one, trying to stay away from undercooked or raw meat, washing hands and washing everything well in the kitchen after you cook or cut raw meat. Like I said, if there's outdoor sandboxes, keeping them covered. If you have an outdoor sandbox and it's uncovered, I worry more about the raccoon roundworm. Bayless ascaris, and my kids, so I was kind of psycho. My neighbor had an uncovered litter or sandbox when my kids were little, and I was like, you're not going over there. I had a box of sand. I'd put it out on the deck. I'd cover it and bring it in the garage at night. So I was like, I know what poops and sandboxes outside, and I don't need my kids digging through it. And then again, good hygiene. If you're cleaning the litter box, washing your hands, if you're picking up things in the yard. The worry we have is that if a woman becomes infected, especially in the first and second trimester, when the fetus is developing, there could be birth defects. And that's why we're so cautious with pregnant women. Now, one thing that I was also told, and that I've told pregnant women, is if you're outdoor gardening, because again, if you're in the garden and garden beds, you're digging up dirt. Remember I talked about aerosolization? If you have feces that has degraded in the dirt, but you're digging it up and then you're inhaling and breathing while you are gardening, there is a potential to aerosol, so you can wear gloves and wash your hands, but if you inhale it, so maybe wearing a mask or not digging into flower beds. Because again, a lot of stray cats like to use people's garden beds as a litter box. So if you notice a lot of feces in your garden bed, you got to be careful. And especially the first and second trimester. And, if you have a client in your hospital and they have a cat, now there's old wives' tales. Well, sometimes people say cats go in the crib and kill the baby and lay on the baby. And my mother-in-law, she was weird. We had cats, and she panicked once because she went to look at my daughter and the cat was sleeping in the crib and she lost her mind. And I was like, my cats aren't going to kill my kids. Like, she was just weird. But, people will sometimes say, get rid of your cats. You do not have to get rid of the cat. If there's plenty of pregnant people that have cats and that are fine. So you can, if you own cats and you become pregnant, you can get your blood drawn to see if you have any antibodies. Have you already been exposed? Do you already have antibodies present? So you can check your blood. You can take your cat in to check its blood to just kind of see, does anybody have any antibodies? Have someone else do the litter box. It's a perfect excuse to say, and it's not an excuse. It is true. You have to be careful. Obviously, I think most sane people wash their hands after they clean their litter boxes. Maybe you want to wear gloves, but don't forget aerosolization. Because even if you do everything good with your hands and your mouth, if you're digging and some of that feces is dry, or you don't want to aerosolize it, so you have to be careful. Maybe not getting another cat while you're pregnant. If you can keep minimal cat population, because again, when you want to know if you're exposed, if you've had your cats for a while, their behaviors. Obviously, also, can you keep them indoor? Now, some cats, once they're an outdoor cat and you try to make them an indoor cat, that doesn't always work well. Behavior problems, and that's a whole behavior thing. But you have to, maybe try to limit them going outside, but washing your hands, especially gardening and cleaning the litter boxes and handling the cat. And making sure all meat is cooked. Because again, this can still get passed in tissues, especially if you have a family member that hunts and you're eating wild game. Now, obviously, if you're getting, and still, steak comes from cows and they can have in the cyst, so, and pork. So, prepared meat at the store is a little better. You just want to just cook everything. And again, I like a rare steak. So it was very hard when I was pregnant to, basically cook all my steaks well. But I did. I was like, I'm going to be good and make sure everything is really, chicken I fully cook, pork I fully cook. But steak, beef, I do like a little more on the rare side. Not mooing at me, but You know, and then sushi, people, most of that seafood, but there is some resources here at the end of the USDA and CDC that do talk about toxoplasmosis, but it can be a fairly serious thing.